Good afternoon, sir. I am Marc, Villaceran, student doctor. May I ask for your name, age, and birthday, please?
My name's Marlon, Odvina. I'm 24. Born July 17th, 97.
For today, I'll be assessing your skin, hair, and nails. And for me to do that, I would have to ask for your consent to touch your body. Would that be okay, sir?
Yeah, my consent.
Rest assured that all of our examination findings will be strictly between me and your attending physician. So first, I would like to ask some questions regarding your past and current symptoms. Then we will proceed with the physical examination. Would you like to have a chaperone to help aid you if necessary?
There's no need for that.
Okay, let's proceed. Mr. Odvina, have you noticed any changes in your skin lately?
Well, I've been noticing some marks on my hands, my neck, but really because I think I've been going outside a lot more, I've been running a lot, I've been camping a little bit this summer as well.
Has your family ever had a past history of skin cancer? And if so, do you know the type, location, and how long ago it was?
I'll be honest, I don't think so. I'm not too sure.
Okay. Do you often do a self-skin examination or use sunscreens, especially when you go running out and on your camping trips?
I don't really check my skin, but I don't really use sunscreen much either.
Okay. How about having any rashes, sores, lumps, or any type of itching?
No lumps or rashes, but I mean, I've been a little itchy, just on the neck and on the hands, but yeah.
Okay. Has your skin been feeling dry as of recently?
A little dry.
And lastly, have you had any noticeable hair loss or nail changes?
Not that I'm aware of.
As a clinician, it is important to discuss topics related to skin cancer prevention and screening to the patient. Skin cancers are caused by a combination of genetic predisposition and ultraviolet radiation exposure, with the most common types being basal cell carcinoma, squamous cell carcinoma, and melanoma. It is important to discuss risk factors for melanoma as it has a high rate of metastasis and high mortality at advanced stages, with rapid increase of incidence in the past 3 decades. Advise the patient to limit exposure to UV radiation by limiting time in the sun, avoiding tanning beds, using sunscreen, and protective clothing. If the clinician suspects melanoma, they should apply the ABCE-EFG method for screening the patient. The physician will note the asymmetry, border irregularity, color variations, diameter, and its evolution, whether or not it is elevated, firm to the touch, and growing progressively. The clinician should also recommend regular self-skin examination for patients who have risk factors for skin cancer, have history with high sun exposure, prior family history of melanoma, and greater than or equal to 50 moles or greater than 5 to 10 atypical moles. Okay, thank you for answering the questions. Now we will have you undergo a full body examination. Please go into the changing room and put on this gown for me. With everything removed except for your underwear, okay?
Okay.
Thank you for changing, sir. And for the exam, would you be more comfortable seated or would you like to lie down?
I prefer to sit.
Okay, now we will start the examination. I'll start by examining your hair and scalp. I'll now examine your head and neck. I'd like to separate the gown now to look at your back. Is that okay?
Yeah, that's fine.
I'll now inspect your arms and fingernails now.
Okay.
Now we will be looking at the upper chest and abdomen. Please assist me in lowering and raising up your gown, please.
Sure.
Abdomen area, please. I'll be checking your thighs and lower legs now. Is that okay?
Yeah, that's fine.
I'll now inspect your lower back and posterior legs. I need to uncover your back. Is that okay with you?
Yeah.
Okay, please stand up, please. I noticed that there was sun damage on your neck, arms, and forehead, so I'll be referring you to a dermatologist to further inspect those areas in order to provide you with a proper diagnosis and instructions. Thank you so much for your cooperation today. Do you have any questions?
I don't think so.
That concludes our skin, hair, and nails examination for today. You may now change back to your clothes and wait as I refer you to our dermatologist. Thank you again, Mr. Odvina.